Good day, everyone. My name is Bola AMAIKE from Nigeria. I'll be speaking to the topic on Stakeholder Group on Aging Africa, the survey on the COVID-19 containment and mitigation strategies, especially how it affects the rights of older persons in Africa. The presentation outline is as presented. I'll look at the introduction, look at some of the survey objectives, the research method used, the major finding, as well as the country-specific experiences, where we'll look at Cameroon and South Africa. And in conclusion, I'll provide some recommendations. So SG Africa, what does it mean? What does it do? Stake Group on Aging Africa is an African regional coalition of civil society organizations and professional organizations working in the area of aging. And with collaboration with other stakeholders, we seek to achieve SDG 2030 as well as AU Agenda 2063. SG Africa has strong commitment to addressing ageism and other practices that leave older persons behind in Africa. We also seek to recognize and integrate the life course perspective to addressing aging issues as well as sustainable development. So by introduction, the sequel to the COVID-19 pandemic, African governments across the continent adopted measures to contain and mitigate the pandemic in order to save lives, as well as restore some level of semblance of life on the continent. Some of these measures have far-reaching consequences for all, including older persons. Therefore, SG Africa decided to do a coherent and coordinated assessment of the impact of COVID-19, the containment strategy adopted, as well as the mitigation strategies used by African government. Our emphasis was largely on the rights and the entitlement context of older persons. Why focus on older persons? In Africa, older persons are beginning to arise as the fastest growing demography on the continent. In 2015, barely 5% of the populations were 60 years and above. This is projected to rise to about 7%, more than 7% by year 2050. So the aging experiences and the particular context of aging on African continent must be addressed from the human rights perspective in order to make the desired impact. So why did we do the survey? Yes, the world passed through trying period during the COVID-19 pandemic. The pandemic infected and affected millions of lives, including older persons. The African continent also was not spared, but our concerns was more on the impact of the containment and mitigation strategies on the rights as well as the welfare of older persons in Africa. The objectives were to look at the pre-existing public health emergency in Africa, government containment and mitigation strategies, what are the progress that have been recorded, and what were the issues covered or not covered by this strategy that government adopted. And lastly, we try to identify disruptive cultural values that affected the containment and mitigation strategy adopted by government. The research method was we strictly used the longitudinal method, looking at SurveyMonkey tool. We got information from 18 African countries through the participants and organizations based in these 18 countries. So major findings, which is basically what I want to talk to us about, share with us today. Most of the participants work in different areas with older persons, but largely they work in the area of advocacy and the promotion of the rights of older persons. When the question about public health emergency issues were asked, 56% confirmed that they had public health emergency in their countries, such as Lassa fever, HIV/AIDS, tuberculosis, and Ebola. These were underlying pre-existing public health problems that worsen and threaten the success of the mitigation strategies adopted by government. So specific containment and mitigation strategy adopted by African leaders and governments were largely a function of WHO recommended measures. The use of face masks, frequent washing of hands, social distancing, lockdown, among other things. When we now ask about the implication of these mitigation strategies on the life of older person, it was a mixed bag, positive effects and negative effects. The positive effect basically meant that these strategies helped them to reduce the spread of COVID-19, but most importantly, social distancing resulted in the neglect and abandonment of older persons. Lockdown also denied a number of older persons that have pre-existing health conditions and challenges access to medical center as well as the means of livelihood. So the issue about either specific protocol, if they were actually taken into consideration in the design of the strategy, majority, 72% of them said there was no protocol bearing in mind the older person. They were just treated as every member in the population. In Nigeria, in Kenya, South Africa, where they had some level of protocol, or just minimal and average, not sufficient enough to address the specific needs and the challenges of older person. And this basically has been demonstrated through the chart I have for us. So when we now asked about other specific issues that were not covered, a number of issues were thrown up again. They do not have access to comprehensive medical care. Age discrimination was not taken into consideration, and they were not given enough information about issues that have to do with COVID-19. And this also has been displayed through the chart we have before us. So the progress that has been made in terms of in the implementation of COVID-19, few countries really made progress. Most other countries did not even make any attempt. There was no protocol, like I said earlier on, like Rwanda, Kenya, Nigeria, South Africa made moderate progress in terms of provision of palliatives, provision of food resources and items to older persons, and advocacy, among other things. Then in terms of cultural values and practices that are considered disruptive to COVID-19 strategy, the opinions were divided. The participants were of the opinion that Africans are communal by nature. You cannot tell me I cannot visit my grandmother. You cannot tell me that my grandchildren cannot see their grandparents. So these were issues that affected the effectiveness of this COVID-19 strategy adopted by government. And if people die, you cannot tell them that they cannot go and bury their loved one, even if they've died of COVID-19. You can't tell us that we can not have a party as Africans. So these were issues that people had with some of the strategy that are adopted by the government. This also is a chart displaying the various types of cultural values and practices that were seen to be destructive to the containment of COVID-19 on the African continent. So in terms of community support, 72% of countries provided both physical as well as mental support to older persons. In terms of social protection, Africa will always be Africa's brother. Your brother's keeper. People took care of their brothers. You don't have to become from the same family. You can't be in the same community, and you're going to be there to take care of them. There was also provision and distribution of palliatives. There was also the psychosocial support of people just stopping by to greet, to visit, and to check on individuals. Their family members also were there to call, to visit. These were some of the community support systems that were available, and they were actually accepted as being very important. So this are several types of community support that were also identified by participants. When we also look at the impact of COVID-19 on older persons, yes, it's a medical issue, health crisis, but more importantly, it has implications for the economic, social, psychological, cultural practices of the people. It heightens inequality, it heightens exclusion, discrimination, vulnerability, unemployment of caregivers, and indirectly affecting the older person as well. Poor people also suffer disproportionately compared to rich persons. Homeless people also suffered in their own space because they were in the open. They had no roof over their head. People that had no access to basic amenities like running water couldn't practice some of the protocol expected of them. All of this exposed some categories of people to the virus more than others. Specific impact of COVID-19 on elders mean more elders died, increased mortality among older persons. Most of them that have pre-existing health condition like hypertension, diabetes, couldn't go to clinic, they couldn't go to hospital, they couldn't get their drugs, their relation couldn't visit them because of lockdown. Some of them were cut off from their relation because of social distances, and disruption of social networks generally affected the well-being of older person and the mental state of health. So as we round up, we looked at country-specific experiences, looking at Cameroon as well as South Africa. Cameroon had actually had serious harm agitation in the country, and this had negative impact on older persons. They were neglected, and more cases of mental health were recorded. There is no special containment or mitigation strategy for older persons in Cameroon. Even the health system they have is very weak, and most times the workers are actually in short supply. The essence of that is this: once there's absence of social support, there's rural migration of caregivers. Your guess is as good as mine. Most older people are abandoned and left alone to take care of themselves. And this further eroded the rights and the quality of life of older persons. But in South Africa, the story is slightly different. South Africa had fantastic, robust, comprehensive documents, national, international documents to take care of older persons. And they have well-established structure to promote the well-being of older persons before the pandemic, during the pandemic, and of course, after the pandemic. They have very rich experience among older persons. They have access to medical care. They have access to palliatives. They were given increased consideration in terms of accommodation in institutions, and a few of them were opportune to have their tests done on a regular basis. So in conclusion, COVID-19 affected everyone, but older persons, because of their vulnerability, are more affected negatively. It deepened ageism, discrimination, as well as inequality. The containment and mitigation strategy adopted by most African countries did not fully integrate the specific needs of older persons. And so COVID-19 recovery method must ensure that older persons are seen as members of the society and they are incorporated as well as other members of the society. The importance of this is this will improve their dignity, their life chances, as well as their quality of life. I'll round up by providing some recommendations. There's need for increased consultation with older persons so their voices can be heard. The peculiar challenges can be incorporated into the development of policies and programs that government want to put in place. Continued provision of medical and healthcare facility will go a long way in taking care of older people in rural area. The increased coverage of pension. Most people are without pension, and if they are not working, they are left alone to take care of themselves. Finally, the government must mainstream age into development program and sustainable development so that everyone will be incorporated irrespective of the age. So we indeed be in a position to say we have left no man behind. Thank you so much for your time and for listening.
Good day, everyone. My name is Marie Beaulieu. I'm the chairholder of the Research Chair on Mistreatment of Older Adults at the University of Sherbrooke in Quebec, Canada. It is my pleasure today to talk about resident-to-resident aggression in time of pandemic. My plan is actually looking at 6 different points in the next 12 minutes, so it's going to be short and sweet. I'm going to tell you a few words about the research project, the goal of this session, the state of knowledge on resident-to-resident aggression, methodology, results, as well as conclusion. This research project is a 3-year project that is funded by a funding body of the Canadian government and also funded by different partners. We are a team of researchers. I'm the principal investigator. And because this is action research, we did partner with a series of private seniors residents. And we really wanted to look at resident-to-resident abuse. And it's the second study that we did on the same subject. The first study was a one-year project. It looked at a needs assessment. And now we were more looking at the ways it is felt by people who were involved in situation. It could be the victims of aggression. It could be the practitioners and also the managers. We started the project before the pandemic, but when the pandemic arrived, we started to document effects of the pandemic, even though if it was not planned that way. So what is resident-to-resident aggression? Well, it's defined by a team of researchers led by Lynn McDonald in 2015. And it says that it's a negative, aggressive, and intrusive verbal, physical, sexual, and material interaction between long-term care residents that in community setting would likely be unwelcome and potentially cause physical or psychological distress or harm to the recipient. What we're saying is that was going on in the street, it wouldn't be accepted. So it doesn't have to be accepted also in those types of residents. And the goal of my presentation is to share some understanding now that we have of the manifestations of resident-to-resident aggression in time of pandemic. Let's start by a general state of knowledge on resident-to-resident aggression. It's been mostly studied out of Quebec. When we did our literature review, we find mainly literature from the United States. And a lot of time we found the studies done in long-term care centers. So with older persons who have important disabilities, it could be physical disability or cognitive disabilities that are in institution. Like I said, our goal is a little bit different because we're in those private seniors residence. So it's apartment for autonomous and semi-autonomous older person. However, Trumpeter in Europe did some work in that field, and he found out that 20% of residents affirmed that they have been subjected to resident abuse, and also 40% of employees mentioned that they see or observe resident-to-resident aggression. What was understudied is, however, the viewpoint of residents. So not only doing stats, but having them to talk about the situation, how they see it, how they feel it. And this is exactly what we did in our study. So there's also a state of knowledge on COVID-19 and older adults. In Quebec, the province of Canada where I am, 97% of the deaths were persons who were aged 60 years and older. And I don't think it's a lot different in other countries of the world. Of the important rate of death number, like 15,000 deaths, 67.5% occurred in congregate residential facilities for older adults. So that's a lot. The studies looking at COVID-19 have been looking at social isolation and loneliness that was exacerbated in the pandemic context. They also looked at challenges experienced in a confined environment. And finally, there's been some work on mistreatment of older adults in a context of pandemic. Actually, some of my team members and I did publish a few papers, and one is here quoted that we did with the International Network for Prevention of Elder Abuse. So this study I'm talking about today is a qualitative study. We did 25 individual interviews, 13 with residents, 6 with employees, and 6 with practitioners that were out of the care facility or the residential facility. So we call them external interveners. That was done in 4 different residents in 2 areas of Quebec. As you can see in the light blue box, we started the interview on March 5th, 2020, and the lockdown started March 13th. So actually we did less than a week of data collection, and that was over. For the rest, we needed to do it by phone or via different platforms such as Zoom, Teams, etc. And it has been a long time, and then we were able to go back with certain numbers of measures, such as wearing the mask, respecting the distance, and everything. What came out in time of pandemic, I'm not talking about abuse yet, but just the fact that we were in a time of pandemic, well, there was a lot of social and psychosocial effects. A loss of autonomy and capacity. Older persons and also the practitioners that we interviewed were talking about social isolation, accentuate negative feeling, the freedom that was curtailed. Some of the residents really expressed the desire to move, saying, I made a mistake by coming to live in such a facility. I should have stayed home. And they were also talking that many persons were a lot less patient than usual. Here is a quote from resident number 8 saying, it wasn't easy, the lockdown. I didn't find it easy for the grocery shopping. I had the groceries done by someone else. I cooked. They brought me organic onions at $7 a bag. I found that difficult. And I have to say here that $7 for a bag of onions is very expensive. It's almost 3 times the price of regular onions. So what we found when we look at these effects is actually the effects of the pandemic are very similar to what we find in the literature of being the effects of resident-to-resident abuse. So it's kind of interesting that 2 phenomena will create the same type of effect. What we found out more specifically in time of pandemic is that resident-to-resident abuse was continuing, but it was changing in manifestation. So maybe we could think that there were fewer opportunities for resident-to-resident abuse because a lot of people were in their own apartment lockdown. However, there was also fewer resident-to-resident situation in gathering spaces because even though if they were going out of their apartment, they were not allowed to be many people in the same place at the same time. So another resident was telling us, of course, there is no more bickering for seats at the tables, and the person laughed. But on the other hand, it has become very, very cold, very, very lonely. People are really lonely. So what we found is actually that there was changes in manifestation that even because there was fewer opportunities and also fewer situation in gathering places, there was, however, new locations. Actually, a lot of residents told us that they were more on their balcony than usually, and there was some insult from one balcony to the others. There was also new triggers because there could be a lot of aggression about the fact of wearing masks, about the registration that was needed to process for activities. So an employee told us, you know, some people forgot that they have to wear it, talking about the mask. They will have it, but around the neck, and they will forget to put it on their nose, or it will bother them because they have glasses. So there, the resident cried out, hey, you don't have your mask. You're not protecting us. So there was a lot of tensions because people were frightened and they were insulting each other. So regarding the management, because like I told you, we did some interviews with employees and managers, we saw that there was a complete overhaul of work methods in the residents, both for the residents and also in the organization. So delays in follow-up, difficulties to help residents in person. And let's be honest, the fact that COVID-19 was going on was a bigger priority than actually looking at abuse or mistreatment. And an employee here is very honest about it. That is so not the time to talk about mistreatment. We're in the middle of COVID-19. So I'm sorry about mistreatment, but I don't have time. We really have more important things to do than dealing with that. I'm sorry, it is a little less important right now. So in conclusion, resident to resident in time of pandemic is still understudied But our study did show that the effect of the pandemic on residents appears to be very similar to the effects of resident-to-resident abuse. So two different phenomena, but same type of impact. The other thing that is important to remember is that it didn't disappear in time of pandemic. The resident abuse really adapted to the new context. So it was going on in different ways. So to counter resident-to-resident abuse in time of pandemic and beyond, we have been developing a program in partnership with private seniors residents in Quebec. And it will be my pleasure to present that program in a year or two at the next conference. Thank you very much for your attention. And please visit our website at www.maltraitancedesainées.com. You will find material both in French and in English. It's bilingual. Thank you so much.
Hello, everybody. I'm going to present a communication about the impact of COVID-19 in older people in Portugal. I'm going to read the slides so that because of the language, it's easier. As everybody knows, the COVID-19 crisis challenged the fabric of our society. Science eventually can help us understand how the crisis influenced our mental and physical health, how we perceive the world, and the way we interact with others. As everybody knows, in March 2020, the World Health Organization declared COVID-19 as a pandemic, and Portugal reported its initial cases. You can see Portugal there in the image. Okay, it's a quite small country in Europe. Well, in this presentation, we present the impact of COVID-19 on Portuguese individuals aged over 60 years old, based in available research data. So I will present some studies concerning this subject. COVID-19 tends to have a more severe impact, both in relation to morbidity and lethality on people with comorbidities and pre-existing health conditions, namely cardiovascular diseases, chronic respiratory pathology, and diabetes. Because older people often have comorbidities, this group was considered more vulnerable to COVID-19. In addition, the environments of long-term care facilities present an increased risk of dissemination of this infection. Okay, so concerning this first analysis, we are going to see some articles, some studies that first are about the impact of this pandemic on the elderly. So we have a study of Novaes in 2021. It is a study that was based in a survey of health, aging and retirement in Europe that was made to see the impact of COVID-19. And so it had really a quite big sample of more than 1,000 non-institutional Portuguese individuals that were aged more than or equal to 60. The outcomes are these ones. The participants experienced higher levels of anxiety, and we can see that 73% felt more depressed and 30% experienced additional sleep problems compared to the period before the pandemic. Only 23 of those that were interviewed maintained their walking routines. Only 8% of the participants went on visiting family members as frequently as before. and 8% of the participants were refused some form of medical treatment. 56 claimed that they experienced healthcare delays. However, only 15 of the participants reported that their health status worsened during the pandemic. So, in conclusion of this study of Novais, the pandemic has had a significant impact on Portuguese individuals aged 60 or plus. Regarding mental health, the findings go to a negative impact. It changed the participants' routines and increased their anxiety and depression levels. Despite the deterioration of healthcare services, most participants did not experience a worsening of their health status, physical health status. Okay, so the next study, it's from Carvalho and from 2021, and it is also about the impact on the elderly. Older people in Portugal are subject to a variety of risks due to exclusion from productive network and situations of poverty, to the loss and disruptions in social networks, leading to isolation, chronic illness, disability, dependence, physical and mental disability. Added to these risks is COVID-19 and, as we know, the resulting pandemic. Although coronavirus affects all segments of the population, it is in the older group that after contracting COVID-19, there are more severe clinical conditions, higher hospitalization rates, and higher mortality rates compared to the rest of the population, which has led to the elderly being classified as a risk group. However, risk health and disease are social constructions, as we know. And this fact means that the way biomedical knowledge and lay knowledge construct risks, as is the case of the elderly group, differ from each other. So in the conclusion of this study, lifestyles that the elderly lead may amplify or minimize the impacts caused by COVID-19. Institutions contribute to the maintenance of a certain security in face of the uncertainty experienced in the outside world, devastated by the pandemic crisis that generated social and personal unrest. Next, we have the impact on formal carers by Barbosa and colleagues. And so we can see that the COVID had impact also in the formal caregivers. This study analyzes the professional perspective of about the impact of COVID. These professionals work in the Portuguese residential facilities. Comparing to the pre-pandemic period, during the pandemic, 784 respondents reported greater difficulties in basic needs care, in working longer consecutive hours, and being housed at residential care facilities. So we can conclude concerning this study that the pandemics arouse serious implications in basic care, dignity, living and working conditions in Portuguese residential care facilities. Professionals are facing high demands that compromise the care that they deliver. Another work from Ascensão in 2021, it's about now the impact on informal caregivers. The results provide important indicators of positive psychological functioning on sandwich generation caregivers. So they felt greater family union, satisfaction in caring, family role models and learning that comes from multiple generational care, and concerning difficulties that were also identified, need for support, both at the family and governmental level. The truth is that as social species, we depend on co-regulation, in other words, of social interaction. The features of co-regulation, reciprocity, connectedness, and trust resonate through our nervous system, providing a narrow biological link between our mental and physical health. So we need connection to feel secure. And so, and secure is very, very important for psychological health. Data also shows that the elderly are the ones that have more emotional functioning during the COVID-19 period. And so, in conclusion, from this data, we can say the COVID-19 pandemic had a significant impact on the elderly population, mainly concerning mental health issues. We can say it is important to make this crisis a turning point in the way we see, treat, and respond to older people, so that together we can build a world with health, well-being, and dignity for all ages. So the data of the different studies show that ageism is now more widespread, even in public institutions. We know now also that there's many discriminating attitudes that are done in name of good intentions, and that the vulnerabilities of the elderly, especially the ones that are facing more problems, are enhanced. So it is important to make this crisis a turning point in the way we see and treat and respond to older people in Portugal, in Europe, and in the world. Thank you.
Today, I'm going to talk to you about the psychosocial impact of the pandemic on older persons in India as a part of our symposium that we are talking about the changes and the violence against the older people from Asia to Africa. In this presentation today, I'm going to talk about the global pandemic struggles that the world faced at the time in the last couple of years. I will talk about the morbidity and the mortality impact on India in particular, and then a little bit about the older persons and the impact that they had. In fact, all of us are aware that over the last 2 years, there has been a reduction in the accessibility of healthcare to every one of us. There were limited means, there was limited availability, and there was difficult times to access these in all the countries across the world, irrespective of the level of development or the advancement of healthcare. The cure of the disease was indefinite, and we were not sure for a long time how this would behave, how the viral infection would pan out, how people would respond, how bodies would react, how immunity would focus, and what kind of drugs were possible to be given. And so the focus largely shifted on prevention of disease, and we were worried about not getting infected rather than trying to struggle with what to do once the infection happened. Till date, India has seen over 42 million cases of COVID-19, and we have had as many as 524,000 deaths. This figure obviously is under debate and under controversy, as is the case with every country in the world. And there are allegations of underreporting, as was seen everywhere in the world, and the deaths are still being counted. We, in the meantime, have been able to get a large number of vaccinations in place, and a substantial portion of older Indians have been vaccinated. The impact on the older persons has been either a kind of a direct impact or an indirect impact. Obviously, the individuals who became symptomatic themselves, or they had one of their close family members as symptomatic positive with disease, developed a direct impact of the pandemic. The older persons we found were at a higher risk of contracting the disease. The incidence was higher. The severity of disease was higher in older persons. The disease behaved more severely, and older persons found more severe disease. And as a result, there has been a higher mortality of COVID-19 in older persons, as has been established across the globe. And in fact, some of the European countries even had higher mortality because of their particular age structure and the nature of infection. Older persons were more prone to disease and had more difficulty with the disease because of several other reasons, including a limited access to the healthcare facility. They were technologically illiterate, or they had difficulty in handling or managing technology, because now, in the face of the pandemic, as physical access and physical interaction was limited, there was increased dependence on technology, and older persons found it difficult to handle technology during this time. They had restricted social networks because of isolation and because of trying to isolate themselves to prevent the disease from transmitting from one person to the other, led to a restriction of the social networks. There were movement restrictions, and people were not able to move around physically from one location to another. In addition to this, there was financial insecurity, and older people who lost their jobs because of the pandemic were not gainfully employed and were finding it even more difficult to live with the financial insecurity. Besides this, there was physical, emotional, and social dependence on other people and on other individuals because of the pandemic, which forced upon them. It has been seen that there is a higher prevalence of mental health disorders in older persons, which has already been established. Despite this high prevalence of mental health disorders, it has been known that there is a low utilization of specialized services like mental health services or psychological health services in healthcare setup. There has been an increased prevalence of depression and anxiety in older persons, and there are several health-related contributors to depression in terms of loneliness, in terms of stressful life events, or cost of medical procedures, which all have contributed to increasing depression among the older persons. There has been an increase in hospitalization in older persons, and especially because of assaults in men, while abandonment and neglect have been seen to be a greater cause of hospitalizations among the older women. Several other risk factors in older persons were identified, which led to a direct impact of the COVID illness in increasing the transmission and mortality. In terms of advancing age, which was itself a single predictor of poor outcomes in COVID-related illness, the comorbid illnesses which the persons were suffering from. An older person, as we all know, has got diabetes, hypertension, hypercholesterolemia, obesity, or several other health deficits which they tend to acquire across their lifespan, resulting in several multiple comorbid illnesses, which increase the burden and increase the severity of COVID-related illness and COVID infection. Depending upon the stage of the pandemic, older persons were more infected, more affected, and more distressed. If there was an infection among their acquaintances, it was seen that the older persons had a much more difficult time with the diseases. And if there was confinement, or among those who were confined to long-term care facilities, to hospice care centers, they were found to have a larger or a more severe burden of disease during the pandemic times. There were problems in research because it was difficult to capture the mortality data, and the estimation of the psychosocial impact itself was both obscure and challenging because it was difficult to measure how to measure the psychosocial impact. And people would not come out with their problems, and this became much more challenging in pandemic times. So we largely saw the direct impact, but then there was an indirect impact, which was among those individuals who had symptomatic infection in their family or in their neighborhood, and they struggled with an indirect impact, which led to a vicious cycle. There were features of ageism, which led to discriminatory isolation. In most families, by their loved ones or their children, they were discriminated, and the older people were confined, or they were isolated to single rooms, and other younger members of the family would go out to earn their living during the days of isolation, but the older persons were left inside the houses and not allowed to go out for protecting themselves and protecting them from getting more infection or getting exposed to the disease. This led in turn to neglect and loneliness. There was much more neglect, there was much more abuse as a result, which led to further depression, anxiety, and much more neglect and isolation. In addition, among those who lost their close ones, among their social network, or among their friends and family, the bereavement was a component which practically has not been studied over the pandemic while we were busy struggling to understand the disease and its direct impact. In the end, the only thing that I have to say is that the older persons have had a significant direct impact in terms of an increase in morbidity and mortality with the illness. However, a large portion of this impact has been just under the surface of the water, and what we have seen as the direct impact is only the tip of the iceberg. But what has been left under the surface of the water are the increased mental health issues. Things like depression, anxiety, bereavement, and loneliness have not yet been studied. And obviously, this has also led to an increase in isolation, neglect, and abuse of older persons. Thank you for your patient attention, and I complete my presentation here.
So good evening, everyone from India. And if you are still logged into this session, I hope you had a decent time hearing about the experiences and the impact of the COVID pandemic on people from Asia to Africa. And I thank you once again for having been a part of this symposium. If you have any questions, please do ask through the chat box. And if there are none, thank you once again, and good night from India.